Hi guys, so I have Sam again in the Next Level Transformation Hub. Sam is a founder of DecentMed. Sam, very welcome today. We're so
Thank you
excited
for
to
having me.
have you. Absolutely. Tell us what we're gonna be talking today, because I invited, and I believe you invited practitioners as well, and I invited from my side. So tell us what we're gonna go through.
Definitely. So for all the practitioners, you understand a little bit about DecentMed, what it is. You might have a better understanding of how it can help you, but you still have questions about what it exactly is from a step-by-step sequential perspective. So what we're going to do today is we're going to go step by step with Ingrida on the process of what it looks like to be a part of DecentMed from A all the way to Z. And then we're also going to have a little 4-minute presentation that's a demo of our CRM. And a CRM is a custom relationship management system, and we'll get into that later. Let's get started.
Amazing. Yes, Sam, let's start it. And guys, just from my side, if you have any questions, do leave those in the comments so Sam can answer these questions for you. Okay, so let's get started. It's the first time I'm doing this thing, so I don't know how it's gonna work, but Sam, fingers crossed.
Yeah.
Fingers crossed. Well, first of all, let's go to your website. One sec.
So for the audience, where she's going to decentmed.org. Just like as you see on my screen, it's decentmed.org, and you'll see.
Yeah.
So what we're going to start is she's going to go to the sign up page.
Yes, sign up.
She's going to click on provider.
Provider.
So now, as you see, this is our sign up page. In order to sign up part of the platform, you put your name, your email, you ask for a password. And if she scrolls down, you'll see that we have 2 tiers. But before getting into the tiers, what you want to know as a provider is how does it work and how is it going to help me grow? So let's get out of this page and go to the home page.
Mm-hmm. Homepage, okay.
So the first element of our platform is that we tailor people's conditions towards you, the provider's modality. People might not know what homeopathy or naturopathy is, but they know when they have gut issues, they know when they have cancer, they know when they have their condition. So go to conditions and pick any condition you want.
Okay, I'm gonna pick cancer.
So she goes to cancer. So according to statistics, 15 million people die of cancer each year globally. In order to validate the effectiveness of not only these treatments, but also of alternative cancer treatments, so that you are an informed consumer, we post provider studies, and we have 4 cancer documentaries on our platform. 2 are dissertations, and 2 are legitimate case studies. So you might be thinking, well, what if I don't practice cancer? What if I'm just a traditional naturopath or a health coach? Well, that's totally fine. If she goes up to the top, goes back to conditions, and just pick another one.
Okay, I pick trauma.
So as she goes to trauma, like I mentioned before, a lot of people don't know what naturopathy is, but a lot of people struggle with trauma. So in order to highlight what you do and how you help people, first of all, as you see on the right, there's Dr. Kristen Barnes naturopathy. So in order to validate not only your treatment method, which we'll get to in a second, but to highlight your expertise, we offer showcase shows and interviews to all providers for your telehealth listing, as well as for these pages. Now scroll down.
Mm-hmm.
So again, people want evidence. So if you click on naturopathy case study, you'll see that we post provider case studies. And you might be thinking, well, what if I don't have any case studies? Well, if you scroll up a little bit, you'll see that there's other ways we can highlight your expertise, whether it's with reviews or just with the things that you're teaching. We want to validate that your treatment method works. So by posting your case studies, and it's nothing crazy, it really is what was the patient struggling with? What was your methodology? What were the results? What are your final thoughts? And that's it. It can be very simple. So now, once the patient has determined that naturopathy works and they have trauma, well, what do they do? So if you click on that button, try naturopathy, you'll see that you can have access to naturopathic providers in your area. Because with naturopathy, it's telehealth based. So Ingrida, put your location in there.
Okay, I'll put Europe.
So you might be thinking, well, what if we don't have any providers in Europe? Well, the way that naturopathy works is that it doesn't have to be location based. You can get naturopathy from Dr. Teresa Vollner, who is the naturopathic doctor that helps to lower your blood sugar, or you can have traditional naturopathic medicine from Meridian Passage Wellness with Dr. Kristen Barnes. Well, now, how do they actually access you? Well, we have two ways that you can get in touch with a provider. The second way we'll get into in a minute with the demo, but the first way is that we embed your calendar, or if you just want it simple, you can call the provider itself. So if you click on that book telehealth session, you're able to call Kristen Barnes directly and have access to her office. And then maybe you're a provider that just has a program. Well, if you scroll up, you'll see that with Dr. Teresa Vollner, she just has a program. So if you click join today, it will go to her program. Well, what if you want to utilize our CRM? So we have 100% HIPAA-compliant CRM that works for billing, insurance. It has a bunch of templates, and we can manage it all for you. So now what Ingrid is going to do is I'm going to mute myself, and you're going to see a 4-minute demo that's going to show you what our CRM is and how it works.
Amazing. Okay, let's see if I can make that screen big. Okay.
Oh, and welcome to this demo of Care Patreon. Care Patreon is a HIPAA-compliant CRM. As you see here, this is the calendar view. You can set up different workspaces for people's locations. We also have an inbox and a way to communicate with clients within a CRM. You can add different tags like telehealth, referral, intake, couple, assessment, and more. You can also assign different team members to each client. Next is the billing section. So with our CRM, we do have Stripe enabled, but you can also send invoices where people can pay you directly. If you want to have everything in-house, they can pay you with a bank transfer, or they can pay you in cash, and you can just mark it as paid so that within the CRM, you have the ability to track everything. Most importantly is insurance. So as far as claims, you can create a new claim for the client. You can also add existing claims, and this helps with insurance billing, as well as sending invoices with potential clients. You can add the services. We have embedded the codes for chiropractic, but if you are in a different modality that's not chiropractic, we can still add the codes in for you as well. As you see here, we sent an invoice to Bobby Doe, and these are the methods in which he can pay. Next is the templates. So there's a lot of different templates. One is the DX codes, especially if you're a chiropractor. So these are all 2025 DX codes. We also have templates for notes. And again, this is not just chiropractic. If you're a nutritionist and acupuncturist, we have notes and templates for so many different things. Neck disability, disability indexes. As you see here, we have over 7,500 resources, almost 8,000. So if we type in chiropractic, we have 5 current resources, but there's a bunch of other tools as well. Treatment plans, intake forms, and so much more. So now let me walk you through the setup when you first create your account. And one thing to note is that we can create an account for you on our platform or set it up for you. It's really up to you. So you can set a physical location and a virtual location. In this instance, The chiropractor chose to have everything within one workspace. I've had other practitioners operate with different workspaces, as you see there. So for Dr. Teresa Volner, for example, she has a Winners in Diabetes that's 100% virtual, so we can embed her Zoom, and as it scales, we'll transfer that over to her other business, Total Care Health Solutions. Another thing that you definitely want to do is set your services. Like I brought up earlier, we have the DX codes so you can set your services. You can also assign those services to different teams. You can have galleries for images for your services so you can brand yourself. You can set up online payments. Again, Stripe is completely enabled. You can assign different team members, and this is how it would actually look. So if we go and copy the link, we can also embed it, and I'll show you that in a minute. But if you copy the link and you go to a separate page, you'll see that a complete portal is set up for you so that you can book with the practitioner, set a different time. You can set your time in Care Patreon, add any message that you want to give, and that's how you do the booking. Now let me show you how to book within DecentMed itself. So within DecentMed, in your telehealth portal, we've embedded that same calendar, set the date, continue, request booking, add your name, your last name, your email, and any message that you want to give. And we also have the ability to call the practice directly.
So to close, that is the demo of the CRM.
I've got talented freelancers for anything we need.
Sorry, I'm just gonna mute it. Okay, please go ahead. Yeah.
So the final element of the platform is connecting the patients with the providers with our apothecary. So if you go to the apothecary, you'll see that we have over 150 plants on our apothecary. Our goal is that we give providers stake in our global apothecary. As the apothecary scales, providers will be able to have insurance. The buy-in is very simple from a patient perspective. You have an ailment. We have plants that are much more effective than pills. Every single plant on our apothecary has legitimate sources with at least 5 to 10 studies for each plant, all verified by PFAF. And that is the platform as a whole. It is, we are helping you with getting patients. We are managing your systems. We're validating your expertise and growing you and highlighting your expertise over time. And then finally, we're creating a system in which the patient and the provider both benefit. And most importantly, you get more clients over time because finally there's an insurance program for a naturopath, for an acupuncturist, for a nutritionist, for a somatic therapist, and more. DecentMed.org/signup/provider, or you can reach me by connecting with me directly on Facebook, or you can send a comment if you have any interest about the platform. Thank you so much for your time today, Ingrid.
Okay, so Sam, I'm just gonna stop sharing, and we'll ask people if they have any question. I already asked in the comments, guys. So if you have any questions, do ask in the comments, and Sam will be able to answer, or you just directly contact Sam. If you have any questions. Yeah.
Either one. In the comments, you can directly add me. You can also give me a call at 813-766-4900. You gotta stay to the end to get that number though. But
yeah, absolutely. Simon, do you want to mention about the workshop that you are running? Because we are global here. We have in Mexico, in America, a lot of people there. Do you want to mention what you want to
great point. So right now, as you can tell, I'm in a coffee shop, and I partner with this coffee shop. They're called Coffee on Point, and I partner with the owner, and we are doing a wellness event. And here in Puerto Vallarta, Mexico, in Adamada Colonia, I can put the address. Actually, one second. Hey, Gina, do you have the address? Yeah. Like a picture or anything? Yeah. So I can show it. I want to show it. So yeah, he's going to show it for anyone that is interested. the address of the location. But if you just type in Coffee on Point, you should be able to find it in Google. But if you want a screenshot, he's about to give me his phone in a second.
Yeah.
But yeah, it's going to be a workshop similar to this, but it will be in Spanish. And there'll be pizza. We have a great chef that will be selling bagels. And yeah, right here it is C. Priscilanio Sanchez. Actually, this is probably easier if I flip it like this.
Fantastic. And maybe, guys, if those of you who, yeah, definitely we can see it. Yeah. But you definitely can contact Sam directly, and he will give you the details about the event. Which day, Sam, is it happening?
It's October 24th. So I think that is
Yeah.
2 weeks from now. Yeah,
Yeah.
2 weeks from now.
Yeah.
So it's on a Friday, and it's probably gonna be about like at 7. We got to verify on the time, but it should be anywhere between 5 and 7 Mountain Standard Time in Puerto Vallarta, Mexico.
Yeah, so guys, if you are in Mexico, do get in touch and attend the event to find out more about DecentMed. It's all about if you are a health practitioner, holistic practitioner, did I say it right, Sam?
Yeah, you
Any
said it
kind of
correct. Yeah.
practitioner, yeah, as you just and want to kind of get more clients, get more exposure. Sam will help you. And Sam, just a little bit, you are working actually globally, and I'm in Europe, I'm in Ireland, you in Mexico. So it
Yeah,
doesn't
we
really
work
matter.
globally. We have a breathwork coach that is in Austria. Like I mentioned earlier, we have a couple providers that do telehealth globally. We have a spiritual healing coach in India. We have a mindset coach in Kenya, Africa. We have ironically, no providers in Mexico yet. But we do have providers in Europe. We have 2 providers in Europe. A health coach as well, in Europe. He's in UK, United Kingdom, England. So we have 2 providers, John Craig, if you want to look him up, Gorilla and She Coaching,
Yeah,
and
yeah,
Tribe Yoga. I mean, if you just go to our breathwork page, you'll find her, but
yeah,
it's scarlettd.com as well. Those are our 2
yeah.
providers in Europe.
And guys, so the company that you can look it up, it's called like on Sam's screen, decentmed.org. So if you want,
DecentMed.org, exactly.
yeah,
Yeah.
yeah, if
So
you,
even if you're not a provider, it's a 50+ page website. We have blogs, we have information, and like I said before, all the information comes from providers.
yeah,
So people don't care what Samuel has to say about healthcare, but they care about what you, the provider, has to say. All I do is use my technology skills and my marketing skills. Oh, and also to the point of marketing, we partnered with a digital marketing agency called S3 on LinkedIn. We will do a dual demo together. That company and myself will do a demo soon coming up. So DM me if you want to be a part of that. If you want to learn more about them, they're called S3 Marketing Solutions. We just partnered with them. You'll see their logo on our tier on our website as well. So yeah, that's another
yeah,
thing.
yeah. Very good. I'm just monitoring the phones, not yet comments. But it could be that we're gonna get later, or could be that they're gonna be coming directly to your inbox.
Yeah, that'd be good too.
Yeah, yeah. So, Sam, is there anything else that you would like to add before we gonna wrap it up?
No, I just want to say thank you for having me. And if I can get Steve on for a Facebook, if you would do a 3-way, I could possibly do that here as well. We'll just got to be in touch on them.
Absolutely. Sam, well, thank you so much for coming and providing the value to our community. I appreciate you, and community appreciates you as well. And guys, again, if you any questions, do leave these questions in the comments or contact Sam directly, and he will be happy to answer all your questions that you have regarding DecentMed, what it is, how it works, all these, and the marketing part of that as well.
100%. Thank you so much for your time, decentmed.org, and I look forward to the next one.
Thank you so much, Sam. And All the best. And guys, thank you so much for watching, and we'll see you next time.